I came to medical school from half a block away. I was working with Baylor and Methodist. I was the chief of section at the Methodist Hospital for some years, and I came almost 30 years ago to a medical center, and I worked 21 years at the Methodist Hospital Baylor combination, and Baylor and Methodist separated, and then I stay for various different reasons at Methodist. During that years, I really worked hard to build up some kind of gastroenterology, hepatology center of excellence. However, too much politics at Methodist. Even DeBecky and Tony Gatto, three of us, we prepared a lot of projects, but none of them came fruition because of political conflicts. In 10 years ago, roughly, my good friend Michael Fallon was the chief here, and he tried to build up gastroenterology, hepatology division. We had some difficulty during the previous year at the UT Medical School as far as the gastroenterology, hepatology activities are concerned. Michael was very active and very constructive in this issue and came talk to me, and I met with Giuseppe Colosardo. Dr. Colosardo at that time was dean, and three of us, we came together and they convinced me, they understood my we've related with gastroenterology or digestive health center of excellent concepts, because this type of center is not available in the state in this caliber, and then they understood and they supported to me, and we built up the center. This center is actually in one floor, 23,000 square feet. We have 5 endoscopy rooms, one X-ray advanced endoscopy suite, and another laboratory is GI physiology and motility lab, which is a very peculiar and particular lab, very effective in the city and around the city. And we have a conference room, a small conference room, but very good for our postgraduate activities. Altogether, here we see approximately 11,000 patients all around the state and city, and we have around at least 7 different countries also we serve. Patients come international level. And then we do around 7,000 plus endoscopic procedures, most of the therapeutic procedures, treatment, complex procedures. It is interesting to inform, we started 4 or 5 faculty, full-time faculty. Now we have over 20 full-time faculty, and we are hiring more. And among that 20 faculty, 6, 7 of them advanced endoscopy trained faculty. And Memorial Hermann system is pretty supportive from the beginning for these activities, and I appreciate that, because this symbiosis by the UT Medical School and Memorial complementary each other. I hope this is going to continue so many years, because it's helping our vision. Now, by the same token, our clinical activities and clinical research goes together. We publish minimum 50, 60 full articles in peer-reviewed journals, and then over 100 presentation in national, international meetings. These are actually supported by Giuseppe. He was dean at that time. Now he's our president. I have various interaction with him, and recently, a year and a half ago, our new chief of the division came, very well known nationally, internationally. Dr. Brooks Cash is our chief of the division, and we have various meetings how we can go further. I have to really mention one other thing. In addition to our clinical activities, our research activities and research productivity, our postgraduate education is very well organized. And then we have every year 3, 4, 5, depend upon the year, fellows, and 2 of them advanced endoscopy fellows, really selected among the 500 applicants, only 3, 4, 5 fellows. So it's very competitive postgraduate education. One other piece I think also we should know, community was very supportive to our activities. I'm so proud to tell you, we started 4 or 5 years ago a research and education foundation with our patients, also friends. They donated large amount of money, and we have over $7 million in the foundation to be used research and educational activities. And at the end of this year, I strongly believe this might go up to $10 million. And I think all these things together is a teamwork. This is not only my work, but I cannot do wonderful faculty support and it's available, and also team Brooks Cash, and we have our wonderful advanced endoscopy group leader Nirav Tosani, and also our postgraduate education fellowship director Drew DuPont. So this is all our team, and we really work very cordially, very collegial way. Our system works multidisciplinary and integrated way. What does it mean? There is really no system at this time established like us in the state. In this floor, we have GI anesthesiology, GI pathology, and also we work very closely with GI surgeons, bariatric surgeons, and also liver transplant. Liver transplant with Dr. Steve Bynen's leadership is progressive, and it's going to be much better. There is a room for the improvement for all of us. What does it mean? We have additional plans. After the success of Ertan Digestive Disease Center, we have 2 more focus. One is citywide and possibly statewide, establish a Digestive Health Institute. Digestive Health Institute, they already allocated a space in the 26th floor, but this building is a little expensive for us. I'm really hesitating right now, but this is here or some other place this is going to happen. Digestive Health Institute is going to cover all these people in the same floor, under same umbrella, very integrated, multidisciplinary way. Our GI surgeons, bariatric surgeons, liver transplant, our GI physiology, GI pathology, and GI anesthesiology we're going to have in the same floor with this more integrated way. I think this is going to be my dream. Moreover, we have more to go, and we have some work, almost 2 years, 3 years right now. There are very interested 54 physicians in the community. They want to come and join our activities, what we're going to call GI Consortium, citywide GI Consortium. We have significant fundamental work on that, but we haven't finalized yet. So all these activities with Giuseppe's leadership and support really come to fruition. And our dean also, I think, supporting us very clearly. So I have to appreciate all this leadership in the UT system. I think this is some kind of mutually beneficial integration. If the medical school look the future right now is much different than 50 years ago when I started academic life. 50 years ago, most focus was research, postgraduate education, and some clinical activities, but clinical activities were not that much respected. Recent years, academic medicine unfortunately changed significantly because of the economics. And that's the reason our medical school leaders understand that issue, and we have to focus with some kind of business model because of the economy, and we have to have academically oriented clinicians, keep them in the system, integrate them, and also try to get the contract properly, because RVU system, you like or not, one of the essential of the medical school survival. So I think in Houston we have a lot of advantages because there is a medical center. UT has fundamental concepts. We have international airport works very well for our international relations. And the city has wonderful setup with a lot of museums and art, and recently very sophisticated restaurants. And we really have some advantage to keep some of the faculty at the medical school and center, and we integrate also with other research group. Our integration with MD Anderson is very crucial. Obviously, we are all under UT umbrella. Our fellowship works together with MD Anderson, and we have some improvement. We're still working on that, and that makes our fellowship very unique. And the GI fellowship in the country, they don't have this attachment for GI cancer experience, so we are happy with that. I think future of the medical school is bright, and we have to work hard with integrated and interdisciplinary way.